Hello, everybody. Welcome back to my channel. I am the scientist, Dr. Jason Liu. By the way, why are you guys upside down? Is that me? Okay, hold on. Anyway, so last week we talked about fat and heart disease. And this week I'm going to talk about how exercise can actually prevent heart disease and keep the heart doctor away. So, generally, there are three different forms of exercise. The first one is aerobic or cardio exercise. These usually involve the high cardiorespiratory demand. What that means, these can increase the breathing rate and also heart rate after an exercise. And examples are swimming, jogging, or even running. The second form of exercise is what we call the resistant exercise. This form of exercise is worked by against the gravity. For example, putting out or doing weights. The third form of exercise involves stretchability or flexibility. These used to flex your muscles. The examples are yoga or even Pilates. The definition of exercise is structured or planned physical activity that used to involve a large group of body movement and muscles. For example, they will involve your deltoid, your bicep, tricep, pecs, or even your gluteus maximus. And usually people are confusing with exercise and also physical activity. For physical activity, that is unplanned and unstructured and involve a whole body movement, but that does not require a high breathing rate and even heart rate. For example, if you're sitting down at point A on the couch, you want to drink water at the kitchen, which is point B. By walking from point A to point B, this is also considered a form of physical activity, but not exercise. And later on, we're going to talk about what is the benefit of physical activity. So the most important question here is, what type of exercise intensity is good for me or even for you? According to the American Heart Association, someone needs to at least have 150 minutes of moderate intensity exercise or 75 minutes of high intensity exercise per week, or even a combination of both to improve cardiovascular health. But in order to measure this exercise intensity, we need to use a sophisticated machine to measure the maximum heart rate or even the maximum oxygen consumption. So because we do not have this machine, we just need to forget about this, but remember the rule of thumb. So this guideline can help you to define exercise intensity based on our personal exercise capacity. For example, if I want to moderate exercise intensity today, I just need to remember I can still talk, but I can't sing. Right now, for example, I'm running. Hey, hi, I'm Dr. Jason, and today I'm going to talk about exercise. Yeah, so this is a form of moderate intensity exercise. But if you want to do a high intensity exercise, just remember you cannot finish a sentence without pausing. For example, oh, hi, I'm Dr. Jason Liu, and God, hold on. So this is a form of high intensity exercise. And bear in mind that everyone have a different exercise capacity. What that means, my exercise intensity could be different from yours. For example, if you are competing with a marathon runner or triathletes, their moderate intensity exercise could be our high intensity exercise because they have a higher exercise capacity. So, the research that I published online that shows that exercise can bring a broad spectrum of benefits to human health and also especially for the diabetic population. And today, I'm going to focus on three main benefits of exercise. The first one is it can improve cardiovascular health. The second one is it can prevent metabolic diseases such as type 2 diabetes and also obesity. The last one is because exercise can release endorphin, which is a hormone to let us feel good, and therefore this is very good for our mental health that can prevent anxiety or even depression. Anyway, let's look at what my research say about exercise in type 2 diabetes. My research has recently been published in a leading medical journal called Circulation Research, and it shows that exercise indeed can prevent the onset of diabetic heart disease. And usually, a doctor can diagnose whether a patient has cardiovascular disease based on echocardiogram and what you know as the ultrasound of the heart. And today, let me teach you how to differentiate a good heart from a bad heart. Now, on the left-hand side, you can see that this ultrasound is from a type 2 diabetic mice with normal cardiac function. So usually, if the line is very curved, that will indicate a good cardiac contractility because the heart can relax much and then pump harder. So these usually indicate a good cardiac contractility. However, if you look at the right-hand side of the ultrasound, this is from a type 2 diabetic mice with cardiac disease. The line is quite flattened. This usually indicates that the heart is very reluctant to pump, so an indication of poor cardiac contractility. However, my research shows that if these normal heart diabetic mice subject to either moderate or high intensity exercise, this good heart function can be maintained throughout the whole period. However, if these good heart function diabetic mice did not exercise, this good heart function will then progress to poor cardiac function, then lead to diabetic heart disease. A good heart function usually needs the supply of oxygenated blood and also nutrients. So this depends on the number of capillaries or the blood vessel in the heart. And what you can see here is that the number of perfused capillaries indicated by the yellow dots is very, very low in the diabetic heart without exercise. So that means they have a low supply of oxygen and nutrients. Therefore, the heart cannot pump normally and they have poor cardiac function. But the diabetic mice with moderate and high intensity exercise has a higher number of perfused capillaries. That means they have good blood supply of oxygen in the blood and also nutrients. So therefore, the heart can pump forcefully and efficiently. And another one on the right-hand side is what I'm going to show you, the coronary blood vessel. Coronary blood vessel is a specialized blood vessels that only supply the blood to the heart. And you can see that in this diagram, the coronary blood vessels is very low in number because the diabetic mice did not exercise. However, the mice that with moderate and high intensity exercise has an increased number of coronary blood vessels. That means they have a good blood supply, therefore good heart function. And what I'm going to show you here is the image that I used to image the coronary blood vessel function using radiation synchrotron microangiography that I done in Japan. So you can see that the coronary blood vessel actually penetrate the whole heart while the heart is pumping. Therefore, this can supply enough oxygen and also nutrients for the heart to pump. Without this, the heart would just cannot pump efficiently and then lead to diabetic heart disease. I guess the most important question here is, how long can the effects of exercise last? What do you think? What if someone is just very, very, very enthusiastic? He or she run for 1 month and then he become very reluctant, very lazy because of COVID-19. That's why he or she stop exercising. Do you think these exercise effects can last forever? 1 year, 2 years, 10 years? No, that is not possible. Because the effects of exercise is dependent on exercise adherence, or what we call exercise compliance. The longer that you exercise, the longer that you will be benefited from the period of exercise. So if you stop exercising, or what we call detraining, within 1 week, the whole body insulin sensitivity will be decreased. Within 2 weeks, The cardiovascular health indicator, which is VO2 max, will be decreased by 4 to 20%. And within 1 month, the muscle capillarization, which is the capillaries that we saw just now, and muscular strength will be decreased and return to pre-training baseline. That means you have to start all over again. At the very beginning of my slide, I told you that physical activity does not provide a direct beneficial effect on cardiovascular health. However, low intensity exercise and also physical activity do provide a very profound effects on insulin sensitivity. These can increase glucose disposal. Therefore, these forms of exercise are very, very good for someone who has metabolic diseases such as hypertension, diabetes, and also obesity. And do you know that on average, we actually sit down at least 15 hours a day? For example, sitting down for your breakfast, sitting down doing your work at your offices, and sitting down watching your phone or even TV. And these can lead to a disease called sitting disease. And these can be very bad because if you sit down 3 hours or more in a day, these will make you 64% more likely to die from heart disease. If you sit down 6 hours or more in a day, this will make you 40% likely to die within 15 years. So in order to break this sitting disease, the American Diabetes Association actually recommended interrupted sedentary behavior, which is to include more than 3 minutes of brief physical activity with every 30 minutes prolonged sitting. For example, if you are sitting down in your offices doing your work, so tired, more than 30 minutes, then you should just sit up and do some head turn, hand turn, or even a very, very simple activity. Just go to the loo or take your coffee just for a break. And these can actually increase glucose disposal. So I hope that you enjoy my presentation today, but bear in mind that the effects of exercise is dependent on sustainable exercise regime. Therefore, if you want to keep your heart healthy, do enjoy active lifestyle, and I hope to see you next time. Peace out.